Are you a candidate for a DIEP flap breast reconstruction? So DIEP flap stands for deep inferior epigastric perforator flap. It describes a procedure where we transplant the skin and fat a little bit above or around your belly button and below your belly button. So think of it as the skin and fat from your belly button down on your abdomen. We transplant that tissue up to your chest to reconstruct your breasts after a mastectomy. So whether or not you're a candidate for a DIEP flap depends on a couple things. One is you have to have had mastectomies, meaning we don't do this for cosmetic reasons. You need to have had your breast, one or both breasts, removed to be a candidate for a DIEP flap. The other is that you need to have enough skin and fat below your belly button to allow us to remove some of it to transplant up to your chest to reconstruct breasts, as well as have enough skin and fat left behind that we can sew up your belly afterwards. So you have to have enough extra skin and fat of your lower abdomen, and you have to be missing a breast. Those are the main requirements as to whether or not you'd be a candidate for a DIEP flap. Some things that would make you not a candidate for a DIEP flap is if you've had a tummy tuck in the past, you're not a candidate because the tummy tuck will basically, it makes a DIEP flap impossible because the blood vessels we need to keep the tissue alive are cut with a tummy tuck. If you've had a C-section, it's probably fine. It's rare that a C-section would damage the vessels that we need for a DIEP flap. If you've had liposuction, it varies. It's a case-by-case basis whether or not liposuction would have damaged the tissue and made you not a candidate for DIEP flaps. You may still be a candidate. It depends. If you had a midline laparotomy, meaning you have a scar up the center of your abdomen, you probably are still a candidate for a DIEP flap. That doesn't disrupt the blood vessels that we need to keep that tissue alive. So the most common operation that would make you not a candidate for a DIEP flap would be a history of a tummy tuck. Otherwise, if you're missing a breast or have had a mastectomy anytime in the past or are going to have a mastectomy in the near future, that makes you a candidate. And if you have enough skin and fat below your belly button, that makes you a candidate as long as you haven't had a tummy tuck or other operation that might have damaged the blood vessels we need to keep that tissue alive. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.